everyone, once again welcome to my Oet channel. Today I came with a peculiar roleplay card which came during our recent exam in 2023, and the peculiarity is it is a home visit. So usually when we will do home visit, some students they used to get some difficulty in the introduction. So anyway, we will go through this roleplay card and we will see how we can present it. So, the setting is patient's home and they have given one small paragraph. That paragraph, it is important paragraph because you will get much idea about your role, patient role, the settings as well as exact introduction and the clue for the conclusion of the presentation also. So, you have to read very carefully, underline and make appropriate introduction and conclusion from that. Okay, so here they have given that a 72-year-old patient recovering from sepsis was discharged 3 days ago after 1 month of treatment in the hospital. You are visiting the patient to dress his or her wound. So from here it is clear that you came here for wound dressing and it's just like a follow-up visit. And the patient is 72 years old. So if it is 60 and above, keep it in your mind. Maximum you have to give politeness during your presentation. There should not be any demanding words like should, must, you have to, you need to, don't. These type of words you should not use. Okay. So the first task is confirm reason for your visit. Example, wound management after sepsis, and find out how patient has been since discharge, like mobility, fatigue, appetite, etc. So, so the starting introduction for all home visit except non-case will be same like this. I will tell you like in easy way. No need to ask 4 separate sentences, 4 separate questions. It will lose your mark. So how we can do? Example, I will start from greeting and self-introduction. Then you have to confirm whether it is a correct home and correct person. Next one, you will confirm your purpose of visit as well as permission to continue the conversation. Okay, so it will be like this. Good morning. Then wait for the greeting back. Okay, just wait for the greetings from the patient. Then I am Rashmi Rajan, one of the registered nurses working in this community health center. If I'm not wrong, is it Mr. John's house? Am I talking to the right person? So what you have to do during 3-minute preparation time, you have to ask patient name and you have to write it over the paper. So imagine that patient's name is John and we asked already the question. Then the answer will be yes, it is. You are correct. Then the next will be, okay, Mr. John, glad to meet you. Actually, I came here for the wound redressing as well as for the follow-up visit of your sepsis recovery. Is it the right time to talk with you? So both we have to ask together. Then after getting the permission, you can start your task. The first thing is confirm the reason for your visit or you already did and find out how patient has been since discharge. Then we can do like that. Before proceeding to the wound management, may I ask you some question if you don't mind? Then, yes, we can ask that. Mr. John, how you are feeling and how you are coping up since discharge? Like, could you please tell me what about your mobility and are you getting any fatigue? Or what about your appetite? So could you please just sum up? Then the answer will be, sister, actually my mobility and it is very less and I'm getting so much tired. Very soon I'm getting very tired if I'm doing any even small works also. Moreover, I could not take any food. So what is the thing? I don't know. That the reaction should be there. Well, Mr. John, no need to worry. I can truly understand your concern. And the next task will be explain importance of good nutrition, aid recovery, building up strength, and find out about patient's food and fluid intake like amount, frequency, etc. So we can tell that. So as you know that you are recovering from sepsis and it is quite natural to get the fatigue and tiredness as well as low appetite. But I can give you some suggestions to improve your condition. But I would like to suggest you to take good nutrition as much as possible because it will aid your recovery and will give up you the strength. So are you getting my point? So like that we can ask. And the next question is, so could you please tell me about food intake, your food intake and as well as fluid intake, like how much amount you are taking and what is the frequency of the food and fluid. So the answer will be, actually I as I told you, I have low appetite and I'm not taking regular food. I'm taking the food also, the amount will be very less and the frequency also, like I'm taking like a morning breakfast, lunch and dinner. But the amount it is very less amount. Fluid actually I'm taking enough, but I'm not sure that whether it is very adequate for me. Then, the next task will be provide diet suggestion like a little but often preferred foods, nutritional, high calorie food, supplemental nutrition, drinks, and explore other symptoms like pain, fever, swelling, and sleeping. Then we can tell that, well, Mr. John, no need to worry. I will give you some suggestions regarding your dietary pattern. So it is advisable for you to take little but often food. And what are the preferred foods you have? You can take without any second thought, because your nutrition, if your nutritional factors are high in calorie, means you will get more strength, as well as you can take some supplemental nutrition drink also, such as ensure. You can give some examples also. Then, so is it, how does that sound? We can ask how does that sound here. Then the next question is explore other symptoms. Then you can tell that, Mr. John, for your further information, I would like to tell you that along with these all symptoms, there will be possible pain, fever, swelling, or problems with the sleeping also, because it is, as I told you, it is quite natural for the sepsis recovery period. But no need to worry, when you will recover completely from the sepsis, all the symptoms will be you will get relief from all these symptoms. So is it okay for, or you can ask that, are you getting my point, or is it clear for you? Okay. Then the next task will be remind patient about sepsis recovery, fatigue normal, slow, gradual process, and find out any other concern. And you can tell that I would like to remind you about the sepsis recovery. As I mentioned, fatigue will be normal, and the sepsis recovery will be very slow, and it's a gradual process for every patient. The recovery will be same like this. So no need to worry or overly concerned about your condition. So do you have any more concern to ask me? Then next task is actually reassure patient about his or her current condition. Recovery as expected, no cause for concern. Outline next step. Checking and redressing wound and checking vital signs, doctor's appointment, precaution. Establish patient's consent to have wound checked and redressed. So they have given many subtasks in this main task. So the thing it is, maybe the question will be, I am so much concerned about my recovery sister. I don't know. Maybe it will lead to any complications. I am afraid of that. Then we can tell that, oh, Mr. John, no need to worry. I can truly understand your concern. Actually, your current condition, it is well, because you are in a good recovery stage, and don't cause for any concern. As usual, we will come and we will redress your wound, and we will check if there is any improvement, and if there is any complications or any infection, if you found out, of course we will notify you as well as the general practitioner. So no need to worry about these things. And if everything is okay, so I can do the redressing, and I will check your wound as well as the vital signs. And if there is anything, of course, I can make an appointment with the general practitioner to make a visit for you. Is it okay for you? It's okay. Then we can ask, do you have any more concern to be clarified before the procedure? Then the answer will be no, sister, I don't have any more concern. And we can wind up. Establish patient's consent to have wound checked and redressed. Then we can tell that, Mr. John, I hope I have clarified all your doubts. If you don't have any other question, may I proceed with the wound dressing and other vital sign checking? Is it okay for you? Yes. Yes, miss. Okay, thank you. So with that, we can wind up this conversation. If you want to give one more reassurance, miss, we can do like this. Well, Mr. John, thank you for allowing me to proceed with the procedure. And once again, I'm reassuring you that nothing is there to be worried about your condition, and this is normal to have gradual and slow recovery process. Meanwhile, if you need any help or assistance, please do not hesitate to contact with us anytime. We are there to help you. Okay, and let me proceed with your procedure. So with that, you can conclude. So in this case, actually reassurance are more important, because patient is worried about his condition. So you have to point that sentence, and even in the middle and the last also, you have to give reassurance, because it is related to old age person's conversation as well as a recovery process. So you have to give reassurance, okay? And because there is no more content to explain more, this is only the peripheral parts and all. So in this way we can conclude. And one more thing I want to tell you, that is establish patient's consent. Some students, they will misinterpret that it is written consent. It's not written consent, it is verbal consent. So you can just ask, if you don't have any other question, may I proceed with this procedure? That's enough. Okay. So this is the conversation, and if you practice in this way, it will be very easy for you. Just practice with your friends or colleagues, or at least with a family member. If you don't have any companion, just you can do by yourself and record it, and listen with the microphone, so you can find out your own mistakes. So just practice in this way, and of course you can improve your speaking. So I hope this video is helpful for you. We will meet with another one informative video, and until then, bye, take care.